I am Dr. Saima Ashraf and I am working as head of the Gynae Unit 3 at the Nishtar Medical University, Multan, and I have been associated with this gynae department for the last 20 years. And today I am with Stuff and Bluff, and I have spared time especially for you people to share some of the very common abnormalities or queries which you face every day. The menstrual cycle, I should start with, is a thing which every woman happens or is going to have in her life, and this is our daily life problem. So when you talk of the menstrual cycle, this is very important to consider that what is normal. Since I have been doing my clinic for the last 15 years, and similarly I have been working in the Nishtar in the gynae department for the last 20 years, and the main bulk which is coming to in our OPDs, in our wards, in our clinics is basically the woman who is having some problem with the menstrual cycle. So I always try to explain them that actually what is the normal menstrual cycle. So the normal menstrual cycle is something which is the monthly menstrual flow, and this is going to happen after every 28 to 35 days. So this is very important that the average length of the menstrual cycle is after every 28 days. But do remember that not every time in your life you are going to have your cycle at the 28 days. So this is the range which is very important to consider. So if I take the low limit, this is the 24. If I take the upper limit, this is 35. So if your cycle length is in between 24 days to 35 days, we consider it as normal. Don't expect every month to have your cycle at that particular 28 days. And when I am talking of the range of 24 to 35 days, do consider that it also includes your bleeding days as well. Like for example, if I say that you bleed for 5 days during a month, and if you are bleeding after around about 20 days, so your cycle length is 20 plus 5, 25 days. So this, although this is not 28, this is not 30, this is 25, but you are normal because you are coming in the cycle length of 24 days to 35 days. So one thing is, this is very important to consider that what actually is the cycle length. So if you are unmarried, if you are married, if you are losing weight, if you are getting weight, if you are having the stress, if you are having the kids, so these are the multiple things which your menstrual cycle varies. It's not like that if I am in the 20s and if now I am in the 40s, my cycle is the same. It's not possible at all. So the second important thing is about the days of the bleeding, that how many days I can bleed. So according to us, every woman is normal if she bleeds for 1 day, for 2 days, but the cycle length should ideally be less than 8 days. So if you are bleeding more than 8 days, this is something which is abnormal. But if you have spotting or bleeding for 1 day, you are also normal. Fine. The third important thing is that what should be the amount of bleeding. How I can assess that I am having the heavy bleeding, the slight bleeding, or this is the normal bleeding. So the simple thing is, if the bleeding is not too much and it doesn't hamper your quality of life, so it means that now you are bleeding normally.
There are certain things that people think are normal, but they are actually not. So we would like to know what are some emotional and physical symptoms before periods that are normal.
Okay. The menstrual cycle, is also associated with the hormonal changes in our body. So there are certain emotional and psychological symptoms which can happen. So every woman is going to have these symptoms, but in certain women these instances is very low, and in some this is very high. So we commonly label as the PMS or the premenstrual syndrome. So this is very common that before your periods you can have a slightly crampy lower abdominal pain, you can have certain degree of bloating, you can feel just like that you are having some heaviness in your breast, you can have the slight headache, slight vomiting, or slight irritability, or a little bit depression. So this is something which is all normal, but do believe that if I am having the severe vomiting, if I am having the severe headache, I am too much irritable that I am not going to carry out my daily life activities. So this is the time that we should consider that now I am having something abnormal and it needs evaluation and treatment.
We'd like to know what causes menstrual cycle irregularities.
Of the menstrual cycle irregularities, there are multiple reasons, and the reasons vary basically with your age groups. So if we talk of the teenagers and extremes of perimenopausal age group, when the cycle is going to stop, so that is basically the anovulation. Likewise, when the girls or the teenagers girls are like to start their periods, there is anovulation. Ovulation is not properly occurring, so they are going to have the irregular cycle. The same problem is going to have in your 50s and your late 45s when the menstrual cycle is going to end. Number two, that could be a fibroid or that could be adenomyosis, endometriosis, that can be PCOS or the polycystic ovarian syndrome, which is a very common disease nowadays. The next important thing is there could be any sort of the bleeding disorder or any drug which you are taking can interfere your normal menstrual cycle as well.
How can girls prevent these irregularities?
Okay, the most important thing is that as such we can't prevent these irregularities. What we have to do, we have to address the underlying reason. Like I have told you, the most of the mothers, they bring their daughters to us, and these are the teenagers, girls who have just started their periods. So the only thing is we just reassure them that within a few months period the cycle is going to get regular as soon as the girl is going to mature. Or sometime if it is not getting regular, we have to put the girls on the hormones for 3 to 4 months. And similar is the story when the cycle is going to end. In between, we have actually tried to find out the underlying reason, like if it is a fibroid, we can remove it. If it is the polycystic ovarian syndrome, we can correct it accordingly, adenomyosis and endometriosis. So we have actually find out the underlying cause and then we address it accordingly.
To speak with a doctor, what's like a criteria that you should know what's happening to me is not normal?
Okay, so in the beginning I have just told you the definition of the menstrual cycle. So if you are bleeding and your cycle length is 24 to 35 days, even if every month there are 5 days overdue or 7 days overdue, this is quite normal. So 10 days before your last period and 10 days after that, this is all normal. This is the normal range where your cycle can fall. So if you are not bleeding for more than 8 days, this is also fine. There is no need to consult a doctor. If you are bleeding too much, you are passing the clots, your quality of life is greatly impaired. Now this is the time period you have to consult your doctors. And one very frequent complaint with most of the girls is coming to us that I have got the scanty flow, I have got the scanty period. You know, the scanty period is not terminology. So actually what is going to happen that nowadays we have seen that most of the girls, they are obese. So whenever you are putting weight, this is indirectly going to affect your menstrual cycle. You are putting the weight, so your menstrual blood flow is going to be get reduced. But still there is nothing to worry about if you are not having the polycystic ovarian syndrome. If you are having this, then this is important, and once you are going to lose your weight, you are going to resume your normal menstrual cycle. So I just want to know that if the woman just know that what actually is the normal menstrual cycle, what are the various variations, how your menstrual cycle changes with your age, with your weight, with your married life, with your kids, with your stress, so many things. So I think so the rate of the admissions or the consultations with the doctors can be greatly reduced.